a big impact on the tourism sector in this country. He deflected questions to the tourism minister about how the government will deal with that rather, but they are certainly thinking about ways they can help the tourism sector rather. From Minister Mark Miller, $650 million announcement for Indigenous communities in this country. That's all new money. And the biggest portion of that, about $285 million, is going towards health services in those communities. It will boost staff, the minister says, by up to 40%. And those health services are, of course, aimed at dealing with the spread of coronavirus. As I mentioned, the Prime Minister is expected. I think we might have a live look at Rideau College in about 20 minutes. That's where we anticipate he will emerge and speak to reporters, as he does almost daily now and has for 2 months. And he will talk a bit more about what we heard from Minister Mark Miller as well as Minister Mark Garneau. Now, last night, the Prime Minister was on a call with premiers around the country. The primary subject of that call, long-term care in this country, and especially in Ontario and Quebec. That follows devastating reports from the military out of those provinces. The military stationed in a number of homes, 5 homes in Ontario in particular, describing pretty horrific conditions. One of those homes, Eatonville Care Centre. We want to talk about that right now with Jacqueline Mitchell. Jacqueline's mom actually lives in that home. She joins us now to talk a bit about what the province has announced about long-term care as well as the federal government. Jacqueline, can you hear me okay?
Yes, I can.
Nice to see you again. I spoke with you a few days ago, and I was really struck by your story, and a lot of viewers were as well. So I wanted to check back in now that the Premier of Ontario, Doug Ford, has announced that 4 of those 5 homes the province will actually take over, and that includes the home that your mom lives in. What were you feeling when you heard that, and do you feel a bit better, I guess, about the situation?
When I heard the announcement, I felt good. I felt that at last he's listening. At last the message has gotten through that these are human beings who have been neglected and abandoned throughout the system. They were left to die, and I had felt that my mother was a sitting duck, that she would just get COVID at any time. But now I do feel relieved. I do feel better. And I must say that Eatonville, in their last update to us last night, had said that there are now 6 residents who are positive and 1 staff. So, I mean, that's good news. The numbers are going in the right way, and that's hopeful. But I'm still cautiously optimistic that I can see my mother soon. I know it's sort of maybe a pipe dream given that it's a pandemic and we want to keep them safe, but I am more optimistic about that. I was in a dark mental space that I would never see my mother again, but now I feel good.
And that's such a big part of all of this, that people who have family members in these homes have not been able to actually get in to see them because of the pandemic. What has that aspect of this been like for you?
You know, I have never had to deal with, you know, a child gone missing or something, but I could well imagine what it must be like, because what I was feeling then was what it must be like to get up every day and know that your loved one is out there somewhere, but you can't connect with them, you can't touch them, you can't see them, you can't find them, and they might be lost to you forever. That is what I was feeling. And as I say, with the new announcement, I am now feeling much better that maybe I will see my mother again.
When we spoke a few days ago, right after that report from the military had been released, you said that you were not surprised by the contents of it. And I think it was important when you said that. It really struck me. And I'm wondering if you can explain for people watching right now why that didn't surprise you.
It didn't surprise me because, like, for my own mother, as I have said before, unfortunately, I believe the person who my mother was in the same room with, that person had passed away. I tried every time I called Eatonville, is my mother in a room with a person who has COVID? They hid behind privacy. Has a person who is one of the people who have died, has my mother roomed with such a person? we can't tell you. We have to protect the privacy of that person. And I'm thinking, yeah, okay, protect that privacy. But what about my mother's right to be safe? What about her safety and security? That's a basic human need and a human right. And under the guise of someone else's privacy, which I respect, you were violating my mother's right? I mean, like, what's the balance that we have to strike in terms of making sure that everyone's rights are protected? So those are the things I saw. I know my mother wasn't bathed. My mother didn't get cleaned. She didn't leave her bed for the period March to very recently. And I don't even know if she has really been into a washroom to get a shower. Her hair hasn't been shampooed. She hasn't been lifted up and down. She had a bed sore that re-emerged. You know, and those things I know are happening. So now I'm hoping that because the hospital has taken over, that she'll get the real medical care that she deserves. You know, my mother cannot express that she's in pain. I don't know that she hasn't been lying there in pain, unable to say, can I have a Tylenol? You know, because of this bed sore. I don't know how they have measured pain for my mother. I'm hoping now that because the hospital is there, that you have true medical personnel, because the PSWs are not medical personnel. They're there as personal support workers. It is unfair to ask them to administer medical attention. My mother, I don't know if she's been seen by a doctor, what if her geriatric needs, if they're being met in that home. So those are the things that worry me. But as I say, I'm hopeful that those things will be attended to now.
And as far as the long-term situation goes, and I mentioned the Prime Minister, we're looking at a shot right now of Rideau Cottage where we expect him to address this subject and the fact that it was talked about with premiers last night. When you look to government for what a solution looks like more in the long term, recognizing, of course, you know, it's so hard on you and your family right now, what would you tell them?
I would say the solution is really very easy. And the reason I say that is because I know what I would want if I get to that stage of my life. I know what I promised my mother and father because they were afraid. My parents did not ever want to go in a home. They wanted to die at home. They wanted to die in their own home. And I promised them that I will take care of them and the system will take care of them. The CCSC model, which takes care of people in their homes, that worked really well. And they met all the needs of my parents while they were living in their own home. From the day my mother and father left their home and went into the long-term care system, there was no bridge to bridge over and to bring over all the resources and the tools that the CCAC and the LIN system has to support people in their homes. We just need consistency of care because it's already there. The Red Cross, the CCSC, and the other contractors that work for the CCSC and the LIN, they're doing, and I'm speaking anecdotally, they did a wonderful job when my parents were in their home. I don't know where the ball dropped between my parents leaving their home and arriving at a long-term care facility. A lot of needs were not met when they got into there. They got food, shelter, clothing. They didn't get safety. They didn't get security. Mm-hmm. Their need for love and longing and belonging, they're not meeting those needs in the home. Those human needs are not being met. And if we can build a system around those basic human needs and the need of a person for feeling loved and belonging, then we can build a system from that. That's what I think. I mean, like there are no exercise facilities as far as I know in that building.
Gotcha. Well,
something as basic as that.
I appreciate the information. I appreciate you sharing your time with us today, and I really do wish your mom the best. Thanks, Jacqueline.
Thank you.
Jacqueline Mitchell came to us from Sudbury in Ontario. Her mother is a resident at Edenville Care Centre over in Toronto. I want to head now, though, straight over to the streets of Minneapolis this hour. That's a live look there. The state's governor has called in the National Guard and declared a state of emergency in response to protests over the death of George Floyd. I want to head straight to Nadia Romero, who is live with CNN there, I believe. Nadia, can you hear me okay? Can you tell us what the latest is?
Yes, I can hear you. Thanks for having me. So we are here in the morning hours of Minneapolis, and finally with some daylight, you can see the damage that was done overnight. So finally showing up is State Patrol. We didn't see them last night. Here they are. The National Guard is out here on the ground as well, and they have been trying to push back protesters, push back crowds. You can see they've put up some more barricades. These windows have been boarded up on these different businesses for quite some time now. Business owners who were concerned and worried about what would happen to their business during all of the looting and the rioting that did happen. It's unfortunate because we were talking about protesting racial inequality that we've seen in this country, black men and women being killed by police officers, and how we as a society stop that from happening and move forward. Instead, we had bad actors that came in, lighting fires all across the area, burning down the 3rd precinct. This is what happens when that frustration boils over. We have gone over the tipping point. We are now on the other side of that tipping point.
All right, thank you very much, Nadia. I really appreciate that update. That's CNN's Nadia Romero. That is a situation in Minneapolis that we continue to track. And in fact, we anticipate the governor of Minnesota will hold a press conference a little later this morning, and we will effort to bring you that live when it happens. Earlier today, of course, one of Nadia's colleagues, Omar Jimenez, was arrested by police. It happened while he was actually doing a live report, and we will continue to follow. He's been released now, but we will continue to follow developments on that front as well. While we wait for, as you can see on the screen next to me, the Prime Minister to step out in front of the microphone at Rideau College to deliver his daily update. He spoke with premiers last night about a number of subjects, and one subject that has been a topic of conversation with at least 2 of those premiers in Alberta and BC is the possibility of the NHL resuming at least its playoff season in one of 3 possible hub cities. So Vancouver, Toronto, and Edmonton are all being considered to be a hub city by the NHL. I want to bring in the mayor of Edmonton to get his take on how that's all unfolding. Don Iveson joins us now from that city. Hi, Mayor Iveson. Good to see you.
Hey, Ashley, thanks. I got this off your desk the last time I saw you in person.
Excellent
nice
mug choice. I appreciate it. I want to start just asking you where things sit with the bid right now. I know you're a big proponent of Edmonton being chosen as one of those hub cities.
Well, lots of questions from our public, first and foremost, and the right questions, too, about public health. Will there be special treatment, or will players be held to the same standards that we're all expected to be held to? And that was one of our caveats going in, was that Dr. Hinshaw, our Chief Medical Officer of Health, needed to be satisfied that all of the measures there to protect the public and players and trainers and hospitality staff who might interact with the teams would need to be satisfactory to public health officials. So that's one of the things that's still being worked through, I understand, but there's a firm commitment from the NHL to achieve that goal, and a firm commitment from the Oilers, too, to us, that they'll honor that caveat. And the other big question is costs for this at a time when cities across the country, on the one hand, are screaming that we're seeing unprecedented operating shortfalls. People were asking me, how can we go after this? How can we put any money in this? And the answer is very clearly, we're not putting money into it. We don't expect to subsidize it. If anything, I'm really hopeful that I'll have some external source of funds to hire back some rec facility staff and Zamboni drivers to host the players of the NHL in some of the best civic recreation facilities that have been built anywhere in the world in recent years, that we'd love to show off to the world and showcase as part of hosting.
I want to delve in a bit with you, Mayor, to the public health aspect that you touched on there, because there has been a lot of conversation lately about what that looks like. So will players get any preferential treatment? And I know the Premier has asked, for example, the Prime Minister to consider this cohort quarantine, which sort of bypasses the idea that most of us who come over the border have to self-quarantine for 14 days. Dr. Hinshaw talked about this cohort quarantine, which means basically the team quarantines as a team. So they have to stay together, they have to operate as a unit, and they stay quarantined from other people in larger society. Premier Horgan over in BC isn't really on the same page. The Prime Minister so far has resisted giving a thumbs up to that concept. How would you address concerns that no matter what, that team is being treated than a regular Albertan, treated different than a regular Albertan?
Well, I think if they've all had tests 5 days ahead and all fly together on a charter flight as opposed to interacting with other people, then the idea of putting a bubble around any group of people, I mean, this is essentially what we're asking households to do. In this case, the bubble's a little bit bigger, but it being a sports team that needs to be able to mix together on the ice and in practice, as long as that containment bubble is intact for the duration of the time, then the logic follows that if there's no virus inside the bubble and there's no opportunity for the virus to get in, or the other reason people were being asked to quarantine was to ensure that if they were bringing the virus in, it didn't get out. So if that bubble is sealed in both directions, then which requires extraordinary measures beyond what people would normally, I think, sign up for and endure. If you're an NHL player and you're being paid accordingly, perhaps you will endure staying inside that bubble for weeks or months to complete the season as a professional obligation, which is, again, different than what we would ask people to say. You know, they won't be able to go to the grocery store. They won't be able to just go for a walk necessarily on their own. And so I think there are some corresponding obligations that come with that are above and beyond what regular isolation would look like for the average person as well. So as long as that bubble is sealed.
Sorry to interrupt, I just wanted to see if you had any indication from the NHL they're open to that, because earlier in the week, Gary Bettman, the commissioner of the league, had said quarantine was a non-starter.
Well, I think I support the federal government's position that the border has to have integrity, and people crossing it need to demonstrate that they're safe traveling in any direction. And I think the Canadian position on the border has been appropriate risk management all the way along, and that needs to be sustained. So we don't want to be offside with provincial or federal requirements. This is an opportunity for provincial and federal governments to work together to get on the same page to support this quality of life and economic opportunity for our country and for our city. But obviously, we've been consistent in saying that public health and worker safety for these players and their attendants needs to be the first priority. And so I'm confident they'll find a protocol that will work.
Okay, I'll leave it there. Thanks, Mayor Iveson. Appreciate your time as always.
Thanks, Vashi. Cheers.
Cheers. Don Iveson is the mayor of the city of Edmonton. The Prime Minister is expected to come down those steps in about 2 minutes' time to address Canadians in his almost daily briefing. I want to bring in my colleague, Catherine Cullen, to discuss a bit about what we might hear. Catherine, what are you anticipating to hear from the Prime Minister this morning?
Certainly we expect him to touch on those announcements earlier by Ministers Miller and Garneau. But Vashi, I think the thing we're really going to want to focus in on today is the discussion around long-term care facilities in this country. As you mentioned earlier, the Prime Minister had his now regular weekly phone call with the premiers. The Prime Minister has said, after the meeting yesterday in the form of a statement, that they have all agreed to take action to do more to protect Canada's vulnerable seniors. But the question really becomes, what form is that action going to look like? What is it that the provinces and territories need from the federal government in order to improve the state of long-term care facilities in this country? Obviously, those reports from the Canadian Forces this week have put the situation clearly in the spotlight, disturbed a lot of Canadians. I thought your guest earlier, Jacqueline Mitchell, really drove the point home. So what is going to be done to help them? Interestingly, 3 Liberal MPs have actually sent a letter, one to Ontario Premier Doug Ford, but another one to the Prime Minister. And one of the things that they are calling for is national standards, enforceable enforceable national standards to improve the situation in Canada's long-term care facilities. I will mention quickly, Vashi, I'm hoping I can squeeze it in there, that another interesting issue that came up on the call last night, we've learned from New Brunswick's Premier Blaine Higgs, is discussion about perhaps loosening some of the Canada-U.S. border restrictions. Premier Higgs told our colleagues in New Brunswick that the discussion is about allowing for some level of family reunification, not after June 21st, because that's the latest border extension that we've heard publicly. But Premier Higgs says that this is something that could be coming in the coming weeks and days. I spoke to a contact with another province who acknowledges that discussion did happen. Not a lot of details, though, so it'll be interesting to see if the Prime Minister is asked about that today.
Well, perfect timing, because we're about to find out. The Prime Minister just stepped down the stairs, and here he is, Prime Minister Justin Trudeau. Let's take a listen in.
Has been working with the provinces and territories to keep Canadians safe and address this pandemic. And this morning, I want to begin with an update on where this work stands. Yesterday, the Premiers and I, along with Deputy Prime Minister Freeland, had our 11th First Ministers meeting since this crisis began. We discussed the very concerning reports regarding certain long-term care homes in Ontario and Quebec. What the Canadian Armed Forces reported is deeply disturbing. That any senior would face this kind of treatment is unacceptable. And as I said to the Premiers, our government will be there to support them as we work together to ensure that our elders receive the care they deserve. In our meeting, we also talked about what we need to do together to help businesses reopen and get people back on the job while keeping our communities safe. Moving forward, it will become even more important to quickly identify and then isolate this virus. To do that effectively, we need to coordinate across the country. A number of provinces have already reached out to us for support on contact tracing, and our governments are currently working together on a data sharing platform. And yesterday, First Ministers were briefed on the work being done by the COVID-19 Immunity Task Force, which will coordinate blood test surveys across Canada. The Premiers and I also spoke about support for workers during this difficult time. Our government will continue discussions with the provinces on ensuring that as we enter the recovery phase, every worker in Canada has 10 days of paid sick leave a year, because no one should have to choose between taking a day off sick and paying their bills. Hier, les premiers ministres, la vice-première ministre Freeland et moi avons discuté.
Freeland and myself talked about the very disturbing reports we received this week about certain long-term care homes in Ontario and Quebec. As a country, we must do better for our elders. As I said to the Premiers, our government will be there to support them, and we will collaborate so that we can ensure that seniors receive the care they deserve. During our meeting, the Premiers and myself also talked about how we can work together to rapidly detect the virus and isolate it. The Premiers received an update on the work being done by the COVID-19 Immunity Task Force that will be coordinating blood test surveys across the country. We also talked about how we can support workers during this difficult period. Our government is continuing its discussions with the provinces to ensure that when we begin the recovery, everyone will have 10 days of paid sick leave per year. Our government is also working with the leaders of First Nations, Inuit, and Métis Nation communities to support them during this crisis. We have already made all kinds of investments, whether it's providing loans to Indigenous businesses, jobs for students, or services for people who live off reserve. But we know that there is a lot more to be done, and today we are moving to the next level.
$650 million to support Indigenous communities on health care, income support, and new shelters for women. Let me start with the first pillar, which is health care. Although we've made progress, there are still communities that are not properly equipped to handle a COVID-19 outbreak, and we need to address that. That's why we're investing over $285 million for public health in First Nations, Inuit, and Métis communities. These funds will go toward more nurses, will help procure specialized supplies, and will support work with First Nations, Inuit, and Métis communities on continued community-driven responses. Having the right health care is essential, but it isn't the only concern facing communities right now. Because of this pandemic, a lot of people also need a hand in paying for the basics. So, as a second pillar of this investment, we are boosting the On-Reserve Income Assistance Program. This money will support people living on reserve who need help paying for things like groceries, cleaning supplies, or rent. A portion of this funding will also help First Nations communities continue to provide services like skills training and support for people as they navigate federal benefits. The work being done in communities by members of the communities is incredibly important to help people get through this very challenging time. And that brings me to the third pillar of this funding, investment in shelters. In April, we announced $10 million so that emergency shelters for Indigenous women and children could adapt to the new challenges posed by COVID-19. This is vital support in the short term. But in the long term, more still needs to be done. So today I can announce that our government is investing an additional $85 million for new shelters for Indigenous women. These shelters will be built in communities across the country, including in the north. No one should have a place to stay when they're unsafe. No one should have a place to stay. No one should have to stay in a place where they're unsafe. No one should be forced to choose between violence or homelessness. These new shelters will offer a path forward when people need it most. Ce matin, j'annonce un
This
nouvel
morning, I am announcing a new investment of $650 million to help Indigenous communities get through this crisis. Of that amount, more than $285 million will be invested in health care. This is money that will make it possible to increase the number of nurses in First Nations communities and buy specialized materials. The funds can also be used to support the work being carried out in First Nation, Inuit, and Métis communities in order to find long-term solutions that fit their needs. We have also expanded the On-Reserve Income Assistance Program to help people pay for their daily expenses. And part of the money under this program will enable First Nations communities to continue to provide a number of important services. Finally, we are investing $85 million in new shelters for Indigenous women. These new shelters, which will be located in the communities, will provide women with a safe place and the resources they need when they need them most.
I want to end today with an update on another measure we've taken to keep Canadians safe. Earlier this morning, Minister Garneau announced that large cruise ships will not be allowed in Canadian waters until at least October 31st. This decision extends the one we made in March, which was taken to protect our coastal communities. COVID-19 is still a very serious threat, but with the right plan and with the right investments, we will weather this storm together. Merci.
Thank you, Prime Minister. We'll now go to the phone for questions. One question, one follow-up. Operator.
Thank you. Merci. First question, Kate Bolangaro, Bloomberg. Line open.
Hi, Prime Minister. I have a question about the Finance Ministry has updated the cost estimates for CERB and the wage subsidy that shows companies aren't using CEWS as much as you'd hope. And it seems that they're happy that the government is footing the bill for these programs. Is this smaller take-up of the wage subsidy a concern for you and the attitude you're seeing from businesses?
I think it demonstrates how hard this pandemic hit our economy and how many people actually found themselves without a paycheck, which is why we were glad we have the CERB to be able to support millions of Canadians who need help paying for groceries, paying their rent. But as we move forward and as businesses start to reopen and need to get people back to work, the Canada Emergency Wage Subsidy will become more and more important, which is why we extended it throughout the summer and will continue to encourage employers to rehire employees to be able to get our economy going once again. Okay.
We realized that this situation was extremely serious, and therefore direct help through the CERB did in fact help many, many Canadians who lost their paycheck. Now, as we reopen the economy and businesses start up and economic activity resumes, we need these businesses to rehire their workers and hire new ones. And the emergency wage subsidy will help businesses to do whatever they need to do to ensure our economy can recover.
So while China has remained quite vocal and firm in pursuing its more aggressive foreign policy, including towards Canada with the Meng case that we saw continuing on Wednesday, and Canada has been rather avoidant in using strong words against China. I'm wondering how much more aggression from Beijing will it take for you to stand up to Xi Jinping, and are you afraid of him?
We have continued to put Canadian interests and Canadian principles at the forefront of everything we do around the world, including with China. We will continue to work to ensure that Canadians have the equipment that we need to get through this situation, while at the same time expressing our concern for the 2 Canadians arbitrarily detained in China, and continue to highlight our concerns around Hong Kong and around questions that need to be asked for the WHO. We will continue to stand up for our principles and continue to look out for the interests of all Canadians. We
will continue to raise our concerns with China about Hong Kong and about the detained Canadians, and also what is happening with the World Health Organization, while at the same time ensuring that Canadians can receive the equipment and the help we need from around the world, including China. We will continue to always place the interests of Canada and Canadians first, and that's what Canadians expect us to do.
Thank you. Next question. Operator.
Thank you. Merci. Prochaine question, Michel Lamarche, TVA. À vous.
Mr. Trudeau, this morning we were listening to Mr. Garneau, who seemed to be saying that the survival of the airline industry was such that the airlines would not be able to refund Canadians. Could you be clearer with travelers and Canadians about this matter of refunds? Because Canadians want to be refunded. Obviously, our top priority is Canadians, and for people who need help getting through this crisis, who need support, and who need money in their pockets, that was what we decided would be our top priority, and that's why we intervened immediately to help them. We also are working with Canadians and airlines to ensure that we can find the right way to ensure that Canadians will be helped, while ensuring, of course, that we have an airline industry after this crisis is over. This is a very difficult situation in many ways, but we have clearly heard the concerns of Canadians in that regard.
Our focus throughout this issue, this pandemic, has been on Canadians, on getting them the support they need, which is why we put out millions, billions of dollars in support for Canadians to help them get through this. I hear clearly the concerns that Canadians have around their air tickets. We will continue to work with the industry and with concerned groups of Canadians to ensure that we find a fair way through this. But I know Canadians at the same time want to make sure we continue to have an airline industry after this very difficult pandemic. Getting that balance right and listening to Canadians is what we will do.
Michel?
Follow up? Yes, but I want to come back to the same issue. Is the survival of the industry threatened by these refunds to Canadians? Now, after the meeting with the premiers, are you seeing that there need to be national directives on the long-term care homes? Well, in our conversations last night with the premiers, we all agreed that we must do better and ensure that seniors right across the country receive high-quality service. No one believes that we should be doing less than that for our seniors. So we will be talking about how we can stabilize those homes now and help the provinces regain control, because we have heard the horror stories. But at the same time, there is a longer-term discussion that needs to happen on how we can ensure that in future years our seniors receive all the proper care and support they need.
What we talked about last night was the importance of ensuring that in the short term we are giving to our seniors all the support they could possibly need through this very difficult pandemic. But we all very much agree that as we move forward, we need to make sure that all of our seniors everywhere across the country get the top quality service and care they deserve. And the federal government will happily be a part of those discussions as provinces lean in on this issue.
Merci. Prochaine question, operator.
Thank you. Merci. Prochaine question. Mélanie Marquis, La Presse. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning,
je veux
Mr.
revenir
Trudeau.
sur la question
I'd
de ma
like to come back to my colleague's question because, with all due respect, you didn't answer it at all. With respect to refunds for airline tickets when flights were cancelled, you say that your top concern is to ensure that Canadians have money in their pockets. But does that mean that, as far as you're concerned, airline tickets paid for by Canadians are luxury products that do not deserve being refunded, that should not be refunded? Well, no, of course, I understand that Canadians had to save some time in order to buy those airline tickets, and we will be working with the industry. We are currently looking at what other airline companies are doing around the world, and we will have more to say about that in the coming weeks. Okay. On another topic, Mr. Trudeau, your Minister of Defense, Mr. Sajjan, was quite clear about the fact that the troops in the long-term care homes cannot stay there for another 4 months. Can you explain to Quebecers and Premier Legault why Ottawa wants to now decrease the number of troops in long-term care homes? Well, the situation facing our seniors is extremely troubling, and as I've been saying from the very beginning, the federal government will be there to help Quebec and other provinces to regain control of the situation in those homes and provide seniors the care that they deserve. But, as I've also pointed out, having soldiers in long-term care homes is clearly a short-term solution, and we will continue to be there and to work with Quebec and the other provinces so that we can find the kinds of solutions for the medium term and the longer term that are needed. This is something we are looking at with the Premier of Quebec and the others, and we will continue to do that.
We will, as a federal government, ensure that we are there to support the provinces as they work to regain control over senior care in their jurisdictions. The situation going on in Quebec and Ontario is extremely worrisome, and we will be there to help. This is something that all Canadians want to see, and quite frankly, the women and men of our armed forces are there to protect Canadian lives and are happy to be doing it, even at risk to themselves. That's what they do, and we should all be incredibly proud of them. At the same time, I have stressed from the beginning that soldiers in our nursing homes is not a long-term solution. It's a short-term fix. And we will continue to work with Quebec and with other provinces to ensure that they are able to regain control over senior care in their provinces. We will continue to be there with them to find solutions for the medium and longer term.
Thank you. Next question, operator.
Thank you. Merci. Prochaine question, Hélène Buzetti, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. Listen, I just wanted you to comment on something because earlier this week it was said that it was unthinkable to extend the confinement because it would be too much for the population, and particularly because it's particularly elderly people who are dying of COVID-19. So what do you think of that statement? Well, first of all, At the federal level, we are taking our advice from public health authorities who continue to stress just how important it is to protect all Canadians against this disease. The fact is that seniors are more vulnerable and have more of a risk of death because of COVID-19, but we have also seen deaths in all segments of the population, and we have to do our part in protecting the most vulnerable and all Canadians. We will continue to try to reopen the economy responsibly and gradually while basing ourselves on scientific principles and the protection of Canadians, which is our top concern. We cannot have a Canadian economy without Canadians, so we need Canadians, and those Canadians have to be healthy. A follow-up? Yes. On another topic, you talked about your call with the premiers yesterday, particularly with respect to the 10-day sick leave days. Now, what was the reaction of the premiers? Did you sense that they were not necessarily in favor? And a week ago, you offered to provide people to take telephone calls. You said they could take 23,000 calls a day. Did any of the premiers take you up on that offer? Yes, some premiers did take advantage of that offer for the purpose of contact tracing, and we continue to work with all the premiers in order to enhance their capacity, because we know that both testing and contact tracing will be absolutely critical if there's a second wave, or even if there's a local resurgence of COVID-19 in various communities in the coming months. With respect to paid sick leave, we did have some very good discussions about this again last evening, and there is a variety of opinions across among the premiers. Some people are concerned about the possibility of our not forcing businesses to carry even more costs during this period of uncertainty, but I reassured them, saying that the federal government would be assuming the responsibility for most of that support, because we know that in the fall, people may want to hide the fact that they're sneezing or coughing and go into work in order to be able to support their families, and that is not good for them or for the place where they work or Canadian society. So we have to avoid any situation where Canadians would have to decide between their health or going into work.
Prime Minister Julie Van Dusen, CBC. You mentioned, obviously, that soldiers they blew the whistle on the horrors that are going on in seniors' homes that a lot of families already know about, but they're not the long-term solution. Now, your letter here that you put out today after meeting with the premiers, you talk about agreeing to take action. I haven't heard any action. I mean, you can't go back on the soldiers because you say they're not the long-term solution. So can you be very specific? What is your action? Because people actually, when you say we're there to help, they actually want to know the details. Is it more money with strings attached? Is it national standards? I mean, what do those words mean?
We recognize fully that long-term care and senior care is a provincial area of jurisdiction. But all Canadians are united in wanting to see better support for our seniors right now and in the years to come. So we have said at the federal level that we will be there to support the provinces, both in the immediate, whether it's more rent money or more resources or whatever it is that the provinces need to get control once again over their long-term care facilities. There are a number of provinces across the country where, although there have been challenges, there are not nearly the scale of problems that we've seen in other places. So we recognize there is a great variance across the country, but as a federal government, our job is to look out for all Canadians and make sure that everywhere across the country people are supported, and we will be there depending on what the provinces need, what their situation is, to make sure that all seniors are protected. Okay. Nous reconnaissons que
We recognize that long-term care facilities and care for seniors comes under provincial jurisdiction. But because this is of concern to all Canadians, and because we must ensure that all Canadians are protected right across the country, we will be there to support the provinces and address their needs in the medium term, in the long term, and in the short term. We are there with the Canadian Armed Forces, and there are discussions now about the need for money or other resources, because we want to help them regain control of their system, which is not the case in certain provinces at this time.
The issue isn't going to go away, but I need to ask you about mortgages, because you must be aware that some families are having to break their mortgage contracts early. So would you consider telling the banks to ease mortgage penalties for those Canadians who are stuck in this position because they have no work?
We have seen banks take significant measures on helping Canadians who have difficulties with their mortgages, and we will continue to work with financial institutions right across the country to ensure that they are there to continue to help Canadians. We know that this is a very, very difficult time for many families. We've made available many income supports, but there is always more to do, and we're going to make sure that financial partners are part of the solution to making sure Canadians get through this.
We know that in spite of all the help that we've offered Canadians at the federal level, there are other challenges ahead of us, and we expect the banks to do their part as well. They have already taken some steps to help people with their mortgages, but if there's more to do, then I know they will step up.
Global News. Good morning, Prime Minister. So just to follow up on your first answer to Julie's question on the specific action. Okay, let's drill down. So the federal government was there to support provinces. What did Ontario, what do they need? What does Quebec need beyond soldiers? What does New Brunswick need? Can we hear some more specifics about what the federal government is going to do in individual cases?
The federal government will be there to support provinces and jurisdictions that need help managing their long-term care situations, whether it's Canadian Armed Forces in the short term, whether it's more resources or more money in the medium and longer term. We recognize this is a provincial area of jurisdiction that they are in control of, but we also know that having certain provinces lose control of the safety of their seniors means that we need to be there to support them as they regain control, and we will do that. But as you point out, there are a range of needs, a range of situations across the country, and one-size-fits-all from the federal government is not the best way through this.
No.
Okay. Nous allons être là pour aider les provinces.
We will be there to support the provinces regain control of whatever falls within their jurisdiction. In the short term, we are there with the Canadian Armed Forces, but over the medium and long term, we will be helping with more money, more resources, depending on their needs and depending on what the provinces ask for.
Is playing the support role to provinces, but there is lots of places for the federal government to lead, and you have your own members of parliament, your own caucus have written you a letter saying, let's have some national guidelines on this. What have you said to Jen O'Connell, Gary Anandasangari, Yvonne Baker? I'm probably missing one, but what's your response? Where's the national guidelines? When are they coming?
Our members of caucus, not just those, but all members of caucus across the country, are worried about the plight of our seniors in this situation right across the country. They are more vulnerable to COVID-19, and they all want to make sure that we are doing everything we can to support our seniors right across the country, and we are. There are, of course, going to be a need to have very real conversations, not just between order of governments, but as Canadians, about how we make sure that we are properly supporting the seniors who build this country with their hard work, the seniors who deserve a secure and dignified retirement. These are things that all Canadians want to see us do better as a country, as a society on, and we will be there for those conversations in the medium and long term. But right now, we're still dealing with this emergency of getting people the support they need faced with this COVID crisis.
Bonjour, M. Trudeau. Louis Blouin de Radio-Canada.
Louis Blouin, Radio-Canada. Yesterday, there was discussion of reopening the border before June 21st, the border between the U.S. and Canada, for family reunification. Mr. Higgs, the Premier of New Brunswick, has already said that he is dubious about this. So where are the discussions on that, and what is on the table? Now, is that proposal being seriously considered? We are currently looking at a situation where permanent residents or citizens have a spouse or children or relatives with a very close, of a close relationship, who are separated by the Canada-U.S. border and who cannot join their family members. I mean, we have seen a number of stories about this in the news lately, touching stories about divided families. So we are currently looking at how we could make a small change for family reunification for very close family members. But of course, because I have always promised the premiers that anything having to do with the border and any measures that might affect them would be the subject of discussion with them in order to have their perspective on possible measures involving relaxing some of the rules in specific circumstances. Because, of course, the agreement we have at the border will continue to be in effect until the end of June as planned. But can there be some slight exceptions to that? I'm discussing that with the premiers, and I've heard some premiers who are open to that. Others have concerns. So we will continue those discussions and continue to ensure that we're doing the right thing by basing ourselves on the safety of Canadians.
We have taken unprecedented measures at the U.S. border to prevent non-essential travel. We've continued with our supply chains and with essential travel, and of course Canadians coming home who then need to quarantine for 2 weeks. But there have been a number of stories in the media over the past weeks, and things we've heard directly from MPs on families who have close family members who are separated because of citizenship at the U.S. border. And we have been looking at ways of perhaps allowing close family members, children, spouses, or parents of Canadian citizens or permanent residents to be able to reunite under strict conditions through a slight modification of the directives for the Canadian Border Services Agency. This would not change the approach on closing the borders until the end of June, and depending on discussions beyond, but it is looking at can we support families that are going through extremely difficult times. However, the borders are an issue that deeply concern all the provinces. So I've made many commitments to them over the past weeks that we would always bring up any issues or concerns we had around changes at the border, and we had a good discussion on it last night. There are a number of premiers who feel that for reasons of compassion, we should and could move forward with this measure. There are others who expressed a certain amount of concern about it. We will continue to engage with them. We will continue to look into this matter and ensure that no matter what we do, we are keeping the safety of Canadian and well-being of Canadians at the forefront of any decision.
Just pour préciser une chose là-dessus, à quelle
Just to
échéance verriez-vous
clarify,
ça arriver dans,
what would be the timeline for that? And on paid sick leave, you said you would be prepared to assume much of the responsibility for that. Does that mean you will be willing to pay for the entire program? And is that enough to convince the provinces to get on board? We are still in discussion on paid sick leave, but what I've said right from the outset is that the federal government does understand the realities facing businesses with their costs these days, and we would therefore be assuming much of the cost of that investment, but the discussions are continuing. With respect to border measures, we are looking at something being said about this in the coming days, but as you know, the discussions are continuing.
So you say that military members in long-term care facilities needs to be short-term, not long-term. But the Premier of Quebec is asking until September, so it's only a few months. Why can't the Canadian government commit to having the military assist long-term care homes in Quebec at least until that time? Is there something else those soldiers have to be stationed to or sent to? Is there a reason that that commitment to September can't be made?
These are operational discussions that are ongoing between Quebec, the Government of Quebec and the Government of Canada and the Canadian Armed Forces. We will continue to have those discussions, and as I said, we will continue to do everything we can to be there to support Quebec as it works to regain control over its long-term care institutions.
What discussions have you had with Ontario Premier Doug Ford? Of course, his government cut $34 million to long-term care funding, and now his province is asking the federal government for financial assistance. Where does that leave the federal government in helping provinces if they've already cut budgets to vital services for seniors and long-term care residents?
I think many of those questions are the medium and longer-term questions around what we need to do to ensure that our systems are properly able to support our seniors. But at the same time, right now, we are focused on helping in an emergency situation, helping seniors, helping Canadians get through a very difficult situation. We will continue to be there for them. We will continue to work closely with provinces and give federal support wherever necessary. I just want to make a quick point on what is happening in the United States. Many Canadians of diverse backgrounds are watching, like all Canadians are, the news out of the United States with shock and with horror. Anti-Black racism is real. It's in the United States, but it's also in Canada. And we know people are facing systemic discrimination, unconscious bias, and anti-Black racism every single day. We need, as a society, to stand together, stand up against discrimination, be there for each other in respect, but also understand that we have work to do as well in Canada, in our systems that we need to work forward on. And I call on all Canadians, whether it's anti-Black racism or anti-Asian racism or racism and discrimination of any type, to stand together in solidarity, to be there for each other, and know just how deeply people are being affected by what we see on the news these past few days.
I'd just like to take a moment to say to Canadians who are seeing with horror what is happening in the United States, that even though this is taking place in the United States, Canada is not free of discrimination and racism. And therefore, we have to do better. Whether it is anti-Black racism or anti-Asian racism or systemic discrimination, we have work to do here in Canada. And we have an obligation now and in the future to be together and to work with each other and show compassion and respect. Because understanding the realities of various people can be a challenge, but I know that Canadians will stand together. We see that every single day in this pandemic, and we will continue to do that.
Thank you. Thank you very much. Julie, I just wanted to wish you all the very best in your next chapters.
Oh, thank you so much.
Thank you.
Prime Minister Justin Trudeau there outside of Rideau Cottage on this Friday, concluding his press conference with remarks about the situation south of the border in Minneapolis. In fact, a developing situation where protests have turned violent. A number of buildings burned down because of those protesters' feelings and their discontent with what happened to George Floyd, a Black man who died in police custody on Monday. We are expecting the governor of Minnesota to speak later this morning, and we will bring you those comments when they happen. But the Prime Minister remarking there that racism exists, of course, in the United States, but also here in Canada, saying Canada is not free of discrimination or racism, and we have to do better. A number of other topics on this side of the border addressed by the Prime Minister, many of which revolved around that conversation last night with premiers, a now weekly conversation. I want to bring in my colleague, Catherine Cullen, who has been following along with the Prime Minister's remarks. Let's start off with long-term care. Catherine, a lot of the questions to the Prime Minister around that, many questions, including from our colleague Julie Van Dusen, around what specifically, when the Prime Minister says we will be there, when that's conveyed to the premiers last night, what exactly does that mean? And what did the Prime Minister say about that?
Well, Vashi, it really did seem that he was in many ways putting the ball back in the court of the provinces and territories, saying broadly he is willing, the federal government is willing to provide the support that they need, but that they need to decide what their specific needs are. Certainly that was part of the discussion last night, the Prime Minister listening to the premiers about what those specific needs are. Long-term care, of course, is provincial jurisdiction. The provinces are in control of the long-term care facilities, or they're supposed to be. I thought the language the Prime Minister was using today was interesting, talking about getting back control of their long-term care facilities. Of course, they're receiving help, Ontario and Quebec, now from some members of the Canadian military, and that is part of the support that Ottawa is providing. Prime Minister's office also noting that they are providing economic assistance in the form of a wage top-up for essential workers. But what else can be done? Members of the Prime Minister's own team, Liberal MPs from the Toronto area, calling for national standards for long-term care facilities that are enforceable. But once again, as we find ourselves in so many issues in Canada, there are questions of jurisdiction here. Is the federal government going to impose something on the provinces and territories? That certainly doesn't seem to be the approach that the Prime Minister is taking right now. He's looking for collaboration, but one province in particular, you think of Quebec, does want more, one specific thing from the federal government, which is that it wants those Canadian Armed Forces members to stay much longer, until September 15th. And you heard the Prime Minister being asked about that, saying, you know, there's still operational analysis going on to determine how long we can stay. I think we got more information, Vashi, frankly, from your interview with Minister Sajjan a few days ago on Power and Politics, where he explained some of the difficulties, that there are a very limited number of medical personnel and that they are working 7 days a week. He says 12-hour shifts. There's really only so long they can sustain this. They will not be able to do what Quebec is asking. The question is, how long will they be able to stay? Quebec's premier yesterday saying, listen, you know, Quebec's taxpayers, we also help pay for the armed forces, and we need their help.
Yeah, there wasn't a lot of clarity today on how long they might end up being there, but you're right, Minister Sajjan was pretty clear that there's no way it's going to be like this for the next 4 months. I did also think that the Prime Minister was speaking very interestingly about the jurisdictional issues, and of course this is a thorny part of the long-term care discussion, but he was talking about the discrepancy sort of in what one province needs versus another, and that's true, right? Like, the situation in Ontario and Quebec is not the situation in every other province. And even when addressing the idea of a solution, he made the point that one size wouldn't fit all.
Yeah, well, and there's an excellent piece both online on The National last night by our colleague Ashley Burke, Kathleen Harris, where they take a look at why BC, for instance, was so successful when it came to the issue of managing the COVID-19 outbreak in its long-term care facilities, because BC was hit as well. Obviously, we talk, you know, day in and day out on this special about the fact that this is actually a series of regional outbreaks, and the picture is different across the country. But BC hit very hard, but it took different specific measures, including, and a lot of people have touched on this, right away, saying that workers in those facilities could not continue to work in multiple facilities. When we talk about the solutions to this broader situation with long-term care, it's widely acknowledged that a big part of this is going to involve money, right? I mean, without question, particularly paying the workers who are in the facilities perhaps a better wage so that there can be more staffing, and so that changing the setup so that people can work perhaps in one facility. Now, some of the discussion has been, should we bring the entire system of long-term care under the Canada Health Act, make it part of the public system, no longer privatize it? Really, though, what you hear the Prime Minister saying today is not talking about taking national control of this, but wanting a sense of where the needs are. And when you think about the laundry list of issues, major issues that need addressing financially in particular in wake of this COVID-19 outbreak, right? I mean, there is an enormous bill to pay when it comes to rebuilding the economy. How big a burden, let's say, a financial burden, is the government willing to take on when it comes to dealing with long-term care facilities, but balancing that with the urgency of this issue. The stories that have come out of Quebec, yes, but certainly Ontario, they are horrifying. They are, it has been said time and time again, not new. People working in these facilities have known for quite a long time that there are, in particular instances, things happening that are terribly wrong, and it has taken this outbreak to really shine a spotlight on that. So the question now becomes, what do we do about it? There has been report and report and report written on this. What is the shape of that action going to look like? I don't think we got much more clarity on that today, other than to understand that the discussions are ongoing and that the Prime Minister is looking for more clarity from the premiers.
And just very quickly, Catherine, before I let you go, some breaking news from the Prime Minister confirmed after Blaine Higgs said in a radio interview earlier with CBC that part of that discussion last night involved the possibility of loosening restrictions for family reunification at the border with the United States.
Yeah, can we call it semi-breaking news,
Sure.
Vashi? So we learned a little bit more in those comments from the Prime Minister, that a bit more specific in terms of the specifics of what it is that the federal government is eyeing, but he also made it clear that it sounded to me like this is not something that's going to happen, let's say, tomorrow or the day after, that they do want to look at, and the Prime Minister, I think, was trying to be very specific about this, they want to look at specific circumstances where, for instance, a parent could be reunited with a child, or we've heard a lot of stories about couples that are split up because of the border, that perhaps those two, a husband and a wife, could be reunited. But the Prime Minister did acknowledge that not all the premiers are on side with this. He said that this is something that he's committed to talking to the premiers about. We heard from Blaine Higgs, for instance, saying that this is a real concern for him as they try to manage this new outbreak right now in New Brunswick, a particularly concerning one. So the Prime Minister seemed to indicate that he wanted a bit more unanimity from the premiers on this. My sense was that he was not ready to announce something just yet.
And that unanimity really doesn't exist
is
yet.
not there, which
Yeah,
he
not
acknowledges
there,
himself. Yes, absolutely.
Yes, he does, for sure. All right, thanks, Catherine. Really appreciate your
welcome.
time and your insights today. The CBC's Catherine Cullen. I want to head over to New Brunswick now. Of course, one of the previously labeled success cases in this province as far as getting a hold of the spread of coronavirus. All the cases had recovered, and there were very few new cases. That changed over the past few days when it was discovered that a doctor working in Campbellton, a community in New Brunswick, had crossed the border into Quebec, come back and not self-isolated, and as a result kept practicing medicine and came into contact, the public health department there believes, with at least 150 people. There are 6 confirmed cases now of coronavirus due to this one individual, and reaction continues to pour in, and we want to get some more of it from Stephanie Engelhardt-Poland. She's the mayor of Campbellton in New Brunswick. She joins us from there right now. Hi, Mayor. Nice to see you. Thank you for making time for us.
Well, thank you for having me.
So I have to ask you first off, just for your kind of emotional or gut reaction to this. I can only imagine how frustrating it is after how successfully things were proceeding in New Brunswick to find out that this is now the case, and sort of what you're possibly dealing with there.
Oh, absolutely. We all figured it was gone away. We had gone a couple of weeks, 3 weeks almost, a month without it. So everybody did think it was gone.
And so how widespread do you anticipate it is? How many people do you think, do we even know how many people this doctor was in contact with?
Not really, but initially 50 at the outpatients department, which would have meant staff, other doctors, nurses, janitors, anybody that was in contact with the ER department. So they did testing, and of that testing, there were 6 new cases as the result. So that's about 12% of all the tests.
And one of those cases is a second healthcare worker, I believe, one of those 6 cases.
Right.
What does it mean for Campbellton? How are you going to have to sort of withdraw or roll back some of the opening? I know provincially that's what the Premier said last night when I spoke with him. What does it mean for Campbellton?
We've rolled back to the orange, so the rest of the province are yellow. And I honestly believe we should roll back to the red until they know to what level this spread is. You see, we have 3 pharmacies and 2 grocery stores that the 20,000 in regional population go to. So even if it was 2 weeks ago, we've got people that may have it that don't know they have it. So it's going to be a mass testing for sure.
So when you say roll back to red, what does that mean in layman's terms? How much of a shutdown is that?
Stay home. Back to not having restaurants open and staying home unless they can do takeout and what have you. So one person essential to go do the essential groceries once a week, and no bubble. So we're afraid they may take our bubble away.
And how do people in Campbellton, how are they feeling right now? They must be pretty frustrated.
Oh, they're mad. They're really, really peeved because they just can't believe how someone who's a professional could have made that bad of a decision. But, you know, everybody makes a mistake, but we all think it won't happen to us. So that, you know, we thought it would never happen to Campbellton. And here we are today. It's like a horror movie, really.
I want to be sensitive here because I know it's a small place, but do people know this individual? Do you know this individual? You know, what's your message there?
On Facebook, they're passing around a picture with name and stuff. I personally don't know him, but I know he's a doctor in the community, which is a good thing. But what's going on Facebook is pretty horrendous, if you ask me. The comments, people in Campbellton are known to being friendly and accommodating, helpful and hardworking, but some of these comments are deplorable and hateful, and they shine a light that we don't deserve to have a light shone on, because we are quite happy when we get new doctors in this region, and we don't care where they're from. They blend into the community and they become us. So, no, it's social media is cruel, and I've seen some pretty rotten messages since all of this has started anyway. So,
what's your message to people composing those messages? What do you want them to hear right now?
You're making all of Campbellton look bad, and there's only a few, and it's always only a few. I understand their frustration. By all means, we all have it because we've been able to flatten our own curve. If we look at how many cases there could be 18 to 100 cases. But the reason we're hoping that there isn't is that we only have 4 ICU beds and there's already 2 being taken. So these are comments that we don't need because we're going to need help from other doctors from other regions, and regardless of where they're from. And if they're a New Brunswicker, for me, they're welcome home anytime.
What have you been tested? Have people in your circle been tested? Like I listened to the Premier say basically everyone who thinks they might have been in contact can get tested. Tell me how that is playing out in Campbellton.
It's playing out that they're spending 2 hours on the 811 call, and I'm getting Facebook messages saying that they can't get tested. They go through all the press 1, press 2, press 3, and then the nurse is going to call you back in 24 hours. So I did contact and reach out to Vitalite this morning and said, look, I don't know what your 811 people are doing, but we need to be tested. So I have not been tested yet, but I tried to get through earlier, but after 47 minutes, I gave up. So I'll try again. I believe that, I was out of the country for March break in the U.S., so I don't mind getting tested. And just to show everyone that there's no shame in getting tested. We may all have it. We don't know.
So right now, just so that I'm aware, because it's different in every province, but do you have to call 811 first and figure out if you qualify to get a test? Is that how it works?
What they want to do is they want to avoid a mass bunch of people all at once arriving for testing. So they're trying to give them, set them 15-minute intervals so that the other one can be gone before the other one comes in. It's all about public safety and spreading stuff and, that good stuff.
I imagine the system, though, maybe wasn't designed for this kind of event. Does it feel that way?
No, but I believe they're more ready today than they would have been 2 months ago.
Right.
So I'm confident that they will catch, because even if the 150 only visited 5 people, that's still too many for this little region. So we don't want 12% of 20,000 because that's 3,000 people. And we would not have any room for 3,000 people.
Have you had any conversations with Premier Blaine Higgs?
No, none. I'll wait for the press conference at 2:30 like everybody else. And no, as long as they're doing what they have to do with Vitalite and get the hospital ready, I really don't have anything to say, other than get her done. And we're here as support if you need any of our infrastructure. And so that's how the Civic Center came about. So the testing can be easy in one door, out the other, that kind of stuff. So I know that they've been preparing the Sharon Ice Palace in Dalhousie as well as the Civic Center here in Hamilton.
They're preparing that for what? For
mass testing.
Mass testing. Okay. And when it comes to the hospital, you had mentioned 4. So your community has 4 ICU beds. Is that correct?
That's right. We only have 4 ICU beds in the hospital.
And 2 are already occupied now due to 2 of the people who were diagnosed because of this.
That's right.
And so what happens if capacity is reached? Is there a sort of plan to deal with that?
Well, I'm sure they're going to start planning that or having already dug out their plans on that, because I know that Dalhousie has a clinic that was a former hospital, so there is possibility to bring patients to Dalhousie and not have to bring them to Bathurst or Edmundston.
And before I let you go, Mayor, for people who are watching right now, you mentioned how you wanted it rolled back, just given the concerns to that sort of initial stage again where they're staying home. I know that it's hard for people. It's trying, it's tiring. For those who are watching right now, what do you say to them? What is your sort of, I guess, message of encouragement when it comes to what they might have to do over the next few weeks?
We flattened the curve the first time with 12 cases. We've only got 6 right now. If we only get 18 or 20, we will be all right. We will get this done. As long as we don't move, the virus doesn't move. So we have 2 weeks and 2 weeks to 21 days before I know the state of emergency has been placed for another 2 weeks. So from there, we'll know how many cases we get in the next few days with all the people that are tested. So don't be afraid to get tested. Call 811. Just keep calling. The system's overwhelmed right now with calls, but just for your family and for your community, get tested. It doesn't hurt. It's not blood, so it's not like they're sticking a needle in our arm. So.
Okay, I'll leave it there, Mayor. Thanks a lot for sharing some of your time with us today, and I wish your community the best during all this, really.
Just have a great thought for us, and for those that have prayers, well, please say a prayer for us. We don't need this with 50% of the population over the age of 60. I really don't want this around.
Well, we certainly are thinking of you. Thanks so much, Mayor. That's Stephanie Engelhardt-Poland. She's the mayor of Campbellton in New Brunswick. That does it for our broadcast here in Ottawa. I'm Vashi Kapelis. You can join me again at 5 o'clock Eastern on Power and Politics. John Northcott is up next with, of course, all the day's big stories and more coverage of COVID-19. Stay with us here on CBC News Network.